Top 20 Medical Receptionist Interview Questions and Answers. A medical receptionist is often the first point of contact for patients, making the role essential for ensuring smooth clinic operations and a positive patient experience. Interviewers seek candidates with strong communication, organization, and multitasking skills who can handle sensitive information with professionalism. In this guide, we'll cover the top 20 medical receptionist interview questions and provide detailed answers to help you prepare effectively, boost confidence, and secure your desired role in healthcare administration. 1. Why do you want to work as a medical receptionist? I want to work as a medical receptionist because it allows me to combine my administrative skills with my passion for helping people. I enjoy creating a welcoming environment for patients and supporting healthcare professionals in delivering quality care. The role offers the opportunity to make a positive impact on patients' experiences, especially during stressful times. Being part of a healthcare team also gives me a sense of purpose and satisfaction in contributing to community well-being. 2. What skills are essential for a successful medical receptionist? Essential skills include excellent communication, strong organization, and the ability to multitask effectively. A medical receptionist must handle phone calls, schedule appointments, and manage records accurately. Empathy and professionalism are critical when dealing with patients who may feel anxious or unwell. Knowledge of medical terminology and software systems is also valuable. Time management, attention to detail, and confidentiality are equally important, as the role involves safeguarding sensitive information and supporting smooth clinic operations. 3. How do you handle a distressed or upset patient? When faced with a distressed patient, I remain calm, listen attentively, and show empathy. Acknowledging their concerns helps build trust and reassurance. I would speak gently, provide clear instructions, and explain how I can assist or direct them to the appropriate healthcare professional. If the situation required urgent attention, I would act quickly to involve medical staff. My goal is to de-escalate emotions, provide comfort, and ensure the patient feels supported and prioritized. 4. How do you prioritize tasks in a busy medical office? I prioritize tasks by identifying urgent patient needs, such as emergencies or time-sensitive appointments, before moving to routine tasks like phone calls or filing. I rely on scheduling systems, to-do lists, and time management skills to stay organized. If demands overlap, I communicate with colleagues and coordinate responsibilities effectively. Remaining calm under pressure and flexible with shifting priorities ensures patients receive timely service while administrative tasks are completed efficiently. 5. How would you maintain confidentiality in your role? Confidentiality is a core responsibility in healthcare. I would safeguard patient records by ensuring they are stored securely and accessed only by authorized staff. I would never discuss patient information in public areas or share details with unauthorized individuals. When handling electronic systems, I would log out after use and follow all data protection protocols. Maintaining confidentiality builds trust with patients, upholds professional standards, and ensures compliance with healthcare regulations. 6. How do you handle incoming phone calls professionally? I answer calls promptly with a polite greeting, stating the clinic name and my role. I listen carefully to the caller, provide accurate information, and record messages clearly when required. If necessary, I transfer calls to the correct department or schedule appointments directly. I remain calm and professional, even with difficult callers, ensuring they feel respected. Effective phone handling reflects positively on the clinic and provides patients with confidence in the service. 7. How do you manage overlapping patient arrivals? When 2 or more patients arrive at the same time, I greet each promptly and acknowledge them respectfully. I check their appointment details quickly and prioritize based on schedule or urgency. While assisting one patient, I reassure others that they will be attended to shortly. Clear communication and efficiency help reduce waiting frustrations. My goal is to maintain fairness and professionalism while keeping the reception area organized and welcoming. 8. What strategies do you use to stay organized? I rely on digital scheduling systems, checklists, and structured routines to stay organized. I keep the reception area tidy and ensure documents are properly filed for easy access. Prioritizing urgent tasks, planning ahead, and allocating time for unexpected issues helps me remain efficient. I also use reminders and calendar tools to track appointments. Staying organized ensures accuracy, reduces stress, and allows me to provide seamless service to both patients and healthcare professionals. 9. How would you deal with an angry visitor? If faced with an angry visitor, I would remain calm, listen without interrupting, and acknowledge their frustration. I would respond politely, clarify their concerns, and explain how I could assist. If necessary, I would involve relevant staff to resolve the issue. Should the situation escalate, I would follow clinic protocols and involve management. My main priority is to diffuse tension, maintain professionalism, and ensure the visitor feels heard and respected. 10. How do you ensure accuracy when scheduling appointments? I ensure accuracy by confirming details with the patient, double-checking dates and times, and entering information carefully into the scheduling system. I review the schedule regularly to avoid overlaps or errors. If changes are made, I immediately update records and inform patients and staff. Attention to detail and thoroughness are key. By maintaining accuracy, I help prevent disruptions, reduce confusion, and support efficient workflow in the clinic. 11. How do you handle confidential documents? I handle confidential documents by filing them securely and ensuring access is limited to authorized personnel. I avoid leaving paperwork unattended at the desk and dispose of sensitive materials according to clinic procedures, such as shredding. With electronic records, I log out when not in use and protect system passwords. Respecting confidentiality is crucial for maintaining patient trust, complying with regulations, and upholding the clinic's professional reputation. 12. How do you balance requests from both patients and doctors? Balancing requests involves prioritizing based on urgency. If a doctor requires immediate information related to patient care, that takes precedence. However, I ensure patients are updated respectfully about any short delays. Clear communication, efficiency, and multitasking are essential to manage both sides effectively. I remain calm under pressure and focus on providing excellent service to patients while supporting healthcare staff. This balance ensures smooth operations and patient satisfaction. 13. How do you create a welcoming environment for patients? I create a welcoming environment by greeting every patient warmly, using their name when possible, and offering assistance with forms or directions. A friendly smile and professional tone set the right impression. I also ensure the reception area is clean and organized. By being approachable and patient, especially with individuals who may be anxious, I help them feel comfortable. My aim is to ensure patients feel valued and cared for from the moment they arrive. 14. How do you manage stress in a medical office? I manage stress by staying organized, prioritizing tasks, and maintaining a calm attitude. When situations become overwhelming, I focus on one task at a time to avoid mistakes. I also take short breaks to recharge when possible and rely on teamwork to share responsibilities. Reminding myself of the importance of my role helps me stay motivated. By staying resilient and composed, I maintain professionalism and deliver consistent service under pressure. 15. What would you do if you realized you made an error in scheduling? If I made a scheduling error, I would take immediate responsibility and correct it promptly. I would contact the patient to apologize, explain the mistake, and reschedule at their convenience. I would also notify the medical staff to ensure they are aware of the change. To prevent recurrence, I would review my process and take extra care when entering information. Being transparent and accountable ensures trust and professionalism are maintained. 16. How do you promote teamwork at the front desk? I promote teamwork by communicating openly, supporting colleagues when workloads are heavy, and respecting everyone's contributions. I share information promptly to avoid miscommunication and step in to help when urgent tasks arise. I also encourage a cooperative atmosphere by being reliable and approachable. Good teamwork ensures patients are served quickly and efficiently while creating a positive working environment for staff. Collaboration is key to the success of a medical office. 17. How do you manage last-minute cancellations? When a patient cancels last minute, I update the scheduling system immediately and notify the relevant staff. If possible, I fill the appointment slot with another patient on a waiting list. I also record the cancellation for tracking purposes. Handling cancellations quickly minimizes disruption to clinic operations. By staying organized and flexible, I ensure schedules remain efficient while maintaining professionalism and courtesy toward patients. 18. What is your experience with medical software systems? I have experience using scheduling and patient record systems to manage appointments, track medical information, and support clinic operations. I am comfortable learning new software and adapting to updates quickly. Accuracy is my top priority when entering data to avoid errors. I also follow security protocols to protect patient information. Using software effectively ensures efficiency, reduces mistakes, and enhances communication across the medical team. 19. How do you manage multiple phone calls at once? When multiple calls come in, I answer them in order, ensuring each caller is acknowledged promptly. If needed, I politely place callers on hold while addressing urgent matters first. I keep conversations concise, take clear messages, and transfer calls appropriately. Staying calm and organized allows me to handle several calls efficiently without compromising professionalism. This ensures patients and staff receive timely and accurate communication. 20. Where do you see yourself in 5 years in this role? In 5 years, I see myself as an experienced medical receptionist who has built strong skills in administration and patient service. I aim to take on additional responsibilities, such as mentoring new staff or contributing to office management. I also hope to expand my healthcare knowledge and potentially grow into a medical office manager role. My long-term goal is to continue supporting patients while advancing professionally within healthcare administration. A medical receptionist interview is your opportunity to show professionalism, empathy, and organizational strength. By preparing detailed answers to common questions, you can demonstrate how your skills align with the role and reassure employers of your ability to handle responsibilities effectively. Remember, your role sets the tone for patients' experiences. With preparation and confidence, you'll be well positioned to make a strong impression and succeed in securing this rewarding healthcare role.